hot topic alert on the Nclex. Postpartum bleeding questions have been on the Nclex lately. Something that you will choose wrong if you don't know the right shock. You will miss this question. If your postpartum patient is bleeding, you choose the wrong type of shock. Miss the next question too, because this has been on case studies. As the Nclex is not just testing you on what is postpartum hemorrhage. They're testing you on how fast can you recognize it and prevent them from crashing. Scenario would be postpartum, the patient delivered 30 minutes ago. Suddenly, you see heavy bleeding, they're soaked pads, and they say something like, I feel dizzy. Nclex is about to ask you, well, what do you do first? But first, you have to know what's happening inside of the body. Patho. Because you have to critically think. Postpartum bleeding is too much blood volume leaving the body. The body tries to compensate by increasing the heart rate. They get tachycardic. Vessels try to clamp down, and the blood flow is prioritized to the brain and the heart. But once she loses enough blood, there isn't enough volume to circulate. And that's when it flips into the shock that the Nclex wants you to know. It's not septic, it's not cardiogenic. Postpartum hemorrhage causes the 4 T's. Write these down. Tone. Do they have a boggy uterus? Trauma. Are there any lacerations or hematoma? Tissue. Is there any retained placenta? Thrombin. Is there a clotting disorder? But here's the twist. It doesn't matter which of those 4 problems caused it. Type of shock is usually all the same. Postpartum hemorrhage causes hypovolemic shock. Because the whole idea of this is there is volume loss. It's not a pumping failure. It's not an infection, not an allergy. Signs you'll usually see first is cool, clammy skin, tachycardia, pale. It could be restlessness or have anxiety. Later signs is they're going to have a decreasing blood pressure, going to have a decreased urine output. Nclex loves that late BP drop. They want you to catch it before it happens. There is postpartum bleeding. Your first action and the answer option you should pick should say something about fundal massage if there is a boggy uterus, or assess the uterus boggy or is it firm, call for help and stay with patient. An intervention could be use a large bore IV and get them fluids. Being supportive would be to give them oxygen, increase their perfusion. Watch for a quantity of soaked blood pads because that equals blood loss. Wrong answers that students normally will choose is reassure her that this is normal. Have her ambulate to the bathroom. Wait and check her in 30 minutes. Document and continue monitoring. Postpartum hemorrhage is an emergency. Answer tips. If you see something about boggy uterus, heavy bleeding, there's something wrong with the uterus and you need to massage and give medicine. There is a firm uterus and heavy bleeding. Is it trauma or a laceration? You need to notify the provider now. Postpartum hemorrhage is not just about bleeding. It's the Nclex wants you to know if you can pick up on that hypovolemic shock that can happen as a result of the postpartum bleeding. If you know the patho of what is happening, you can prevent what is going to happen in the future. That's what the Nclex wants you to know. That's what I go over in Simply Nclex. I break down all of the topics that the Nclex wants you to know just like this. You want more information about Simply Nclex, you want to read more information, you want to see some reviews, comment down Simply Nclex. I'll send you over all of the information. Sure, you tag a nursing buddy, share this out, save this so you have this when you go study. Hope this helps you and happy studying.